I'm an intensive care nurse and I've been working here with Menzies since May 2020. And really my role is to help strengthen the response to COVID. That was around the first wave and Timor preparing and doing some training for healthcare staff. And now we're actually in the middle of the Delta wave, so we're really looking after a lot of very sick patients. So my role is really strengthening the healthcare system to deal with that here at the treatment centres. We have 2 treatment centres in Dingle. Springwood support group contacted me last year actually, looking for ways to help in Timor Leste. That was when I was back in Darwin prior to deployment here. And we had a number of good conversations about what could be useful. And really, the donations that they've provided in the first instance have allowed us to go forward with training for the healthcare workers who would then be deployed to these treatment and isolation centres. So over the course of last year, we trained multiple groups. They were from the National Hospital and they were being prepared to come and treat COVID patients here at Lahane and Veracruz. So the training course we put together was with 3 Timorese trainers. They were experienced nurses who were trainers in the National Hospital, and we put together a week-long training course for their colleagues. We do about 10 to 15 people at a time, and the Springwood support group, their funds enabled us to provide lunches for participants, basic office supplies, whiteboards, pens, pencils, markers and other training needs. And so that was a really big help getting people ready to come and work in the COVID centres. It was a new experience for people. They were, not surprisingly, quite scared sometimes to be here. And this was the only direct training that they received before their deployment. Another really nice aspect of the training has been working with the Ministry of Health. And we actually brought 5 participants from each referral hospital to Dili to upskill them on some of the therapies and the treatment techniques for COVID-19 patients. So that was the districts of Akusi, Maliana, Suai, Baokau, and about 25 participants came to Dili, doctors and nurses. We were able to provide them 2 weeks of training in some instances, so that was a bit more of an intensive course, and they're now back in their districts treating COVID patients. Again, the funds that we received from the Springwood East Timor support group went into providing the meals and some of the supplies required to train them. We actually deployed some funds directly to the COVID treatment centre here for some basic supplies and equipment that were lacking. The treatment centre had filled up in only a matter of days, and when we operationalised it, we realised a few things that were really important just weren't available. Simple things like some tools to change oxygen cylinders, gloves for the workers, electrical PowerPoint extensions were needed to run the ventilators and the non-invasive breathing machines, monitors, things like that. So that was really helpful to have funds that could be used quickly. We also bought bleach, cleaning supplies, some personal hygiene and toiletries for the staff. We were all living and working here for the last several weeks. It was extremely busy. So it was really greatly appreciated, those funds, and to not have to spend too much time changing budget lines and going through long, laborious processes. I could use those funds immediately, and that's had a big impact here at the treatment centre, just making things a little bit more operational. So there are a lot of the challenges. What are some of the great successes and opportunities? Look, having Timor step up and really provide treatment at a higher level, I guess. We've never used equipment like this before. Staff have never had to perform like this before. So the preparation and training has been really important, and I'm really so proud that the Timorese have done such a great job. We have a great team up here. 2 of Timor's best doctors are working with us, some young, really enthusiastic nurses and team leaders. And we've managed over the last couple of weeks to provide a high level of care. The training that occurred to staff in the districts, I just received a WhatsApp group message from them last week. We stay in contact. And they actually used a ventilator in Maliana at their referral hospital. A woman had severe complications and bleeding after childbirth. And she sounds like she nearly went into cardiac arrest. And they actually used what they learned on the ventilator. They put her on the ventilator. She was ventilated for a day, treated intensively, and there was a picture on the WhatsApp group with her recovered and looking well. So small stories like that help us know that some of the work is having an impact. Another nice story is during the course of some initial training last year, I was contacted about a respiratory therapist, and that's someone who works with ventilators and respiratory equipment and respiratory patients. She had just returned from the Philippines, and she's Timor's only respiratory therapist. And she actually joined us and became one of our trainers, and she did such a good job. I recommended to the Ministry of Health that she be employed immediately. So I know from all the Timorese staff here, and I'm the one Malay that's been working here, so that's I feel very lucky. I would like to directly pass on my thanks, my gratitude to the Springwood Timor Leste support group. I've enjoyed giving you all updates over the last several months. So I do hope you all feel part of what's going on up here. The work is hard and challenging, but I think we've set a great example for what Timor can do. They should be very proud. We've had good support from the ministry, great support from a couple of really amazing Timorese doctors, and I'm really thrilled at the results for patients, and I hope we can continue it as long as we need to, which is probably going to be for a while, given the way COVID is changing around the world. So we're hoping that this short-term support can really lead to long-term changes. So once again, I'd like to thank everybody in Australia. Thanks for thinking of us. Anyone who's thinking of donating small amounts, they can make a difference. The small items we bought do have a big impact. And so again, thanks again, and appreciate your support.